Welcome to another episode of Surviving COVID-19. We have been doing this for this will be the 10th episode. So there are 9 other episodes that are available on my YouTube channel and actually right here on Facebook. And so you can get to them and get to watch the previous episodes. We've treated lots of topics as far as COVID-19 is concerned. Today, what we want to do is to have a conversation with the survivors, hear from the survivors, get to know how they're coping. Earlier on, we were told how when you get COVID-19, you're going to be living with some complications, health complications for a pretty long time. So we want to find out from the survivors here in Ghana if they're having similar complications as we have heard happening elsewhere. And I have brought on board some doctors as well who will be speaking and answering your questions and whatever anxieties that you have as far as COVID-19 is concerned. I've had my own anxieties as far as COVID is concerned, and I've shared them with Dr. Godfred Techi, who is at the UGMC. He's a lead clinician there. And probably we can start off having that conversation as we get the others to join us. So at some point, thank you very much, Dr. Godfred Techi, and welcome to Surviving COVID-19.
Thank you, Israel. It's always a pleasure to be on your show.
Yes. So at some point, you recall, I called you up and I was telling you that I've been using the face mask for a while, and I had some challenges with breathing. And so I called you up, and then you advised me what to do and what not to do. And I'm sure there are lots of people out there who may be having those similar apprehensions. In my case, I felt that if I had the face mask on and I was breathing in, I didn't think that my lungs had taken in as much air that they should have. And so I felt there was an issue. But you explained it to me. You probably should explain to everybody else.
Okay. I think the face mask that you were wearing, if I remember correctly, was
N95.
It FFP2? It was N95.
Yes.
Okay. So N95 produced almost like a complete seal around your face, specifically your mouth and your nose. The 95 probably means that it can protect you up to at least 95% of the time from getting infected with whatever you are preventing yourself with.
Oh, okay. So that's how come it's called N95.
Yes.
95.
When they do the test, at times they quote it as between 95 to 98. Okay. But I think 95 is like the standard. So anything above is a plus. So there are different types of N95s. Okay. Some can give you 99%, some can give you 98, some 96, but the least is 95.
All right.
Okay, so what I was trying to explain to you was that research has shown that when you wear the mask for long, that particular type of mask, that gives you almost like a tight seal. You are just breathing in sort of air which is coming out and you are breathing. So after a while, of course, the rich amount of oxygen is low. So then you can start having signs of oxygen deprivity, or you can have very low amount of oxygen in your system. So you could get signs of, like, you can get headache, you can feel like you're struggling to breathe and all that. So for those of us in the treatment center where it is recommended, I use N95. Normally after 2-3 hours, you have to remove it, because it's not very comfortable wearing it for long hours, okay? There have been reports of people wearing N95 and after 4 or 5 hours, actually feeling lightheaded and headaches, and some even had fallen down. So that's why I gave you the advice that as much as you could, in circumstances where you are not around a lot of people, where you can maintain adequate enough of distance from them, you could just use the surgical mask and not the N95. If you want to use the N95, it shouldn't be for long period, like beyond 2 hours. I mean, that's not healthy. And I also said that people on social media pick this information and replace the important part of the N95 with just any mask and say doctors are saying when you wear a mask for a long time you get this and that, but that people are a bit mischievous. I don't know why they do that. This is specific for a particular type of mask. So if you are wearing a surgical mask, I think the commonest color around is blue. A surgical mask. You can wear it the whole day, you'll be fine. So I'm happy a lot more people are not using N95 because they're in short supply globally. And the more we use it, the more we increase the demand and the more expensive it gets and the less it will be available to people like us who need to use them. I know you can get some, Israel. If you could pass some to us, we'll be very happy.
All right, but I took your advice, and so I stopped using the N95. I have, and the N95 is reusable. So I leave one on my dashboard. But what I use daily, for the daily use, I just use a surgical mask, one with the blue front and the white back here. So that's what I use. So I took your advice, and thank you very much for sharing that advice. And to everybody else who is watching now, as you heard Dr. Techi advise, you're not supposed to be using the N95 for prolonged hours. It's not for prolonged use, it's for medical use. And so I was just being too no. And so I've stopped, I've stopped that. So Doc, we're still waiting for our survivors to join us. There was one who joined who just gone up. I'm hoping that they can come back in. But I would want to find out from you, what has been the situation of the survivors? You get to see them and you have treated, you guys at UGMC have treated and discharged loads of people. Are the fears that others, that we had initially, that if you have people get COVID, sometimes they're even asymptomatic, they may be living with some health complications for some time to come. Are you getting that? Are you realizing that's happening here in Ghana?
Okay, we've had a few. I mean, there have been some people that we've discharged from COVID treatment center at UGMC who have gone home and come back with similar complaints that brought them in the first time. When we check all the various parameters that we check for all patients with COVID-19, they were within normal range. So we reassured them, got them counseled by a clinical psychologist, and we didn't give them any drugs. They went home, and we also used a Lucy app to follow them up at home, and they've never come back to us. And the few that have gotten back to us in terms of phone calls or through the Lucy app are doing very well. So I'm only assuming that the rest are also doing very well. Just that they have not reached out to us after we discharged them, or after we had an encounter with them and reassured them and they left. They haven't gotten back to us. But a few have gotten back that they are fine, they are doing well. And I think some of them, it was more of a psychological issue. Okay. The things they went through, I mean, being in an isolated area where you don't interact with a lot of people, you only come out once in a while, and the initial fear, people thought they were going to die. And actually some also witnessing others die. So it has this psychological thing on us, which tend to make people always panic. But the long-term effects, we'll get there when we hear more comment from the survivors. We'll talk about the long-term effects. Thank you, Israel.
All right. Now, I have Nana Pokia joining us. Nana Pokia, I want you to do a few things for me before we start the conversation. There's the light is coming from behind you, so it makes your face look dark. So if you could reposition yourself so that the light will show on your face, reflect on your face. And then if you could also tilt your camera. Yes, this looks a lot better. If you could tilt your camera, then we're going to have you in landscape instead of portrait as we have it now. So that will be great. And yeah, so Dr. Techi, you're saying that you feel that it's more of a, okay, Nana Pokia, you're just fine. You're great now. And I could come to you right now if you're ready. All right, so just unmute Nana Pokia and let's have you join. So I want you to introduce yourself to us and we'll take it from there.
Okay, so I'm Shelley Poku-Akan, Deputy Director of Nursing at the University of Ghana Medical Center. So at the emergency unit. Yeah.
All right. So Shelley, you happen to be a survivor, right?
Yes.
Okay. So now we've gotten to a point where we're not having conversations. I don't think there's still a few people who doubt that COVID is real. But I think we've moved beyond that to the point where we know that COVID is indeed real because we have lots of survivors. Well, we have more than 44,000 survivors right here in Ghana. Some haven't been too lucky and they have died. So for you, I'd want you to briefly tell us what the experience was like. Share your experience with us, and then we'll go on to the other question that we have.
So I got exposed from the clients that came to the emergency unit who were positive. So knowing from there that the client was positive, after a week, I started experiencing some symptoms. That is itchiness in the throat, headaches, chest pain. The headaches were very, very severe and some form of coughing. So because I knew I had been exposed, we went on to take the samples. And then when the sample came, it was positive. So I think a lot has to do with the psychological aspect, as he stated, because you know, a lot of people have died. And being a medical personnel at the same time, becoming a patient, you sometimes, even though you know how things are supposed to go, you become a patient, definitely. And the psychological aspect weighs you down. So mostly you need the counselors to come in. So I am a survivor. I went on my medications and then I self-isolated and I'm doing fine now, as you can see.
Yeah, you're doing very fine. It's obvious that you're doing very, very fine. But are you having, you know, we've had stories of people having COVID and being stigmatized. Did you have to endure any of that?
Yes, I did.
Oh, you did?
Yes. So I was actually stigmatized by my house help. Actually, when I was given the news, I told her that the two of us couldn't be infected at the same time. So I would want her to maintain a distance and not come too close to the room where I was self-isolating. And once in a while, when I open the windows, you find her even wearing face masks outside the confines of my wall. Like even in the whole house, the very big house in the compound, you find her wearing her mask. And when you call her like to do something for you, I was stigmatized, and she basically left actually.
Did she leave because she had COVID?
Yes, she left.
Really?
She left.
Oh, that's quite unfortunate. Has she made contact with you since she left?
No.
Oh, wow. That's interesting. But what is the situation like for you now? There are people who were told that are going to be having complications. You're not one of those, are you?
As he rightly stated, we hear the effects sometimes you may or may not have. But as it is now, I've not had any effect. I think I've even done a brain CT, but nothing showed anything. So we wait to see what will happen, but we hope for the best.
Yeah, we certainly do. Dr. Techi, this story about a house help stigmatizing the madam it's quite strange to me. Is this something you've come across before?
That's my deputy director of nursing services, so you know that I'm aware.
Okay.
I'm aware. I mean, for me, it's no news. I mean, I'm aware of this story, but then stigma is real in Ghana because of the way we do our things in this country. Not necessarily with her, but as a people, we tend to behave like that. If Israel, if you remember when TB came, when HIV started in Ghana, we've always been talking about stigma. I think as a people, I don't know whether it's fear or it's just that we enjoy doing some things. I've realized that we like stigmatizing against virtually everything. If we still stigmatize against leprosy, even somebody even has, example, somebody has a seizure disorder, convulsions, and traditionally they'll say, hey, don't go and marry from that family, they have seizures or they have convulsions. So I think it's endemic in our culture. But with time, I hope as the NCCE and the rest, the civil society keep talking and engaging people, with time, this will become part of us so that we don't have to be stigmatizing against people. And even among health workers, if my DDNS will bear me out, among health workers, when we started seeing patients at the emergency, and those of us were involved in the COVID treatment center, people in the hospital were avoiding us. They didn't want to come near us. I'm talking about people in the hospital. Some people actually stopped working with us because of fear of getting infection. So it's not just the public. Even among health workers, people stigmatize against colleagues. So it brings about some secrecy here and there, and it doesn't help anybody. So I think there's a lot of work that needs to be done in terms of advocacy. So here, maybe I'll call on all the legally mandated commissions and authorities that are supposed to be educating people. The ones that come really to mind is the NCCE. We have a lot of work to do because I don't think COVID will be the only disease. More disease may come, but it's about how as a people we relate to others who get infected, unfortunately. It may not be true anything they have done wrong. So all they need from us is support and love and not to stigmatize against them.
Now, Shirley, I'd want you to tell us a bit more about that experience in the hospital, the fact that some of your colleagues were actually stigmatizing you. I mean, I would want to think that your colleagues would have or should know better.
Well, actually, it wasn't before I got stigmatized, but it was basically like every staff at the emergency. So, because of the numbers, at a point in time, you would run short of, let's say, and you need support. And you ask somebody to come in, and they are not prepared because that is the COVID ward. So if we should come in, then we are going to get infected. And I think that initially a lot had to do with fear. And for me, I would attribute like that happening with my house help as fear, because the people don't know what the outcome may be. It's a new disease and anything can happen. So most people, even though they knew, the percentages of deaths that were being recorded outside the country took a toll on everybody. Nobody wanted to come close to those at emergency. And when it comes to the hospital setup, it's not only just health personnel. You have those from the IT, administration, and the others that forms the core to support the hospital system. So you want to call in somebody to, let's say, come and work on a PC or a software to allow you to do your work. And that's where the problems will come in. So the core people is just a few people who had that perception. But when you come to those who were the non-medicals, that is the supporting staffs, that is where we were having most of the stigma from. They were not comfortable coming to the areas where we were attending to patients who were positive or suspected to be COVID patients.
But I want to think that having had more than 44 1,000 cases of COVID-19, it would have gotten to a point where people will be more welcoming or receptive of people who are even suspected to have COVID. Has that changed at all?
Yes, it has. You can see that there is ease now, and most people who would either to not have come to the ward are now coming in when they are invited to perform a function or two. So I think that the fear has died down after seeing that a couple of people like myself have recovered and we are doing well.
So generally, what are some of the stories, survivor stories you've heard from people you know who have had COVID, apart from yourself?
So, actually, whilst I was self-isolating, I had clients calling me from the house and sharing their experiences. One person, the mom died from COVID after attending a funeral, but because she turned positive, most of the relatives now attributed the death of her mom to her. So that is because she infected the mom, that's why the mom died. So in those periods, most people, if you had to self-isolate, you should have the rooms in your house to do the self-isolation. So where you have numbers in the house, it became difficult. And if you have young ones, especially when it came to mothers, and then you have to now self-isolate in your house, it was difficult in a way because you couldn't explain it to the younger ones to understand that this condition is not good enough for you to come close to me. So I think those were the barriers people were experiencing initially. Yeah.
Right, Dr. Techi, so I was asking Shirley, we have over 44,000 survivors or recoveries and discharge, which would mean that typically people become a lot more receptive and welcoming of people who are suspected to have COVID-19. Would you say that this is the case?
I think everything in life, initially people are afraid and stuff like that, but with the passage of time, with more information and people actually seeing a lot of people recovering, sort of people become more calm and they are not that much afraid. And we want to believe that they will still be cautious. So far, I think because we've not had so many bad cases, like having so many deaths, some have died, regrettably so. But I think even when I look around the hospital, people are now more receptive, okay? When I interact with my classmates on social media, I'm a Santa Clausian, I went to the Center College. So when we interact, I see that people are now more receptive, people are more calm, as compared to initially when people were very scared. And I mean, a friend told me he's not been out of his house for a month. That's when we're at the height of, now he goes about his activities, wearing his mask all the time. I'm happy that people are still wearing masks, despite the fact that we've accepted that it's a disease that probably is going to be with us for some time. But it's right, generally, I think people are now a bit more calm, which is the news we wanted to spread from the beginning, that we should spread calm and not fear. And because when you are afraid, when fear grips you, you make wrong decisions. And you become, at times, trying to be careful, you rather expose yourself unnecessarily. So I'm happy where we are now as a nation and as a people. And I pray it gets better and better by the day.
Yeah. So yes, we talk about people wearing masks, but we realize that we don't have a lot of people actually wearing their masks. In fact, the studies the Ghana Health Service has been doing in recent times indicates that we're having a lot more people not wearing their masks, which is really a problem, and which is why what we'll seek to also do with this program, to let people get to know that you need to continue wearing your masks. Probably if it's coming from survivors, it would the message would go out a lot better. So Nana Pokia, would you have a message for people who are out there who deciding that, well, COVID is gone. We're now having just about 800 active cases, 44,000 people, more than 44,000 people have survived. And so there's nothing to worry about.
COVID is still out there. The mode of spread have not changed. Fortunately or unfortunately, the fact that you get exposed doesn't mean that you build an immunity. That aspect is there. Some people have been exposed, they build the immunity. Some people were exposed and they did not build immunity. So if you don't build immunity on your first exposure and you get exposed again, then you are going to get infected again. So COVID is still available and the mode of spread has not changed. So I would advise people to still wear their face masks and then maintain the social distance, and when they are in public and where they are meeting friends, they should still maintain the protocol that has been set for prevention of COVID.
All right, I have Nana Kwesi joining us. Nana Kwesi, thank you for making time to join us on Surviving COVID-19. I want you to introduce yourself and we can carry on the conversation from there.
Yes, my name is Nana Kwesi. I'm in Accra. I work with a pharmaceutical company. I'm a young guy of 30 years. I think that's all for now.
Okay, so the most important bit of the conversation or your introduction has to do with the fact that you're a survivor.
Yes.
Okay.
So it started by one fateful Friday whilst I was working. So we were called to all come back to the head office in Accra. So I went and we were all told that there was going to be a segregation at the office. So I started, I was like, why? Somebody get them or something. So fast forward on Monday, they asked us all to come report to the head office and undergo the testing. So I did mine on Tuesday. On Thursday, I received my results. It was via SMS from Noguchi, and it tested positive. So my general manager, the chief executive officer of the company, called me and he was like, how am I feeling? I was like, I'm super good. I'm not having any symptoms.
Nana Kwesi, I'm having a difficulty hearing you. If you could speak up a bit.
Can you hear me now?
Yeah, I can hear you, except that it's faint. So if you could just raise your voice a bit.
Okay, sir. So the result came in on Thursday, one Thursday evening via SMS. That was positive. So fast forward, the chief executive of the company called me and he was like, how am I feeling? I was like, I'm super good. I'm not having any symptoms. So I was doing anything normal. I was active, like no symptoms, no coughing, no sneezing.
Yeah. Nana Kwesi,
no chest.
Did the information or your positive confirmation,
Yes.
Your results, were you the one who had to tell your company about it or your company knew about it?
My company knew about it.
No, were you the one who passed on? Because you were telling me that text message came to your phone.
Yeah, I'm sure Noguchi called them because my boss was the first person to break the news to me.
Oh, okay.
On Thursday. So on Friday, Noguchi sent me an SMS.
Okay, so
yes,
you got the message from your boss first, and then it followed.
Yes, sir.
Later got the text message from Noguchi.
Yes, sir.
All right. So yeah, you tell us more about the story. Then your boss called you.
Yes, so he called. I was like, I'm super good. He was like, okay, I should isolate myself for a while. I was like, oh, okay, I'm okay. So one strange thing I was considering was, apart from Noguchi just sent me a test. They didn't make a follow-up on how I'm doing and all of that. So I had to go and isolate myself. And funny enough, I didn't take azithromycin. I only took vitamin C and zinc.
You're saying you didn't take azithromycin. Were you expected to take? Were you expected to take that, or did somebody tell you to take that?
Because I work with a pharmaceutical company, I had a little knowledge about how this virus works.
Essentially,
So I knew
if you are taking the azithromycin, you're essentially self-medicating.
Yes. I didn't even go to the extent of taking it because no one called me to. The only thing that I came across was go and isolate. There wasn't a follow-up on what I'm supposed to do and all that. But since I'm coming from a pharmaceutical company, I knew what I was supposed to do. So I only did vitamin C and zinc and smoothies. I'll just blend apple coupled with cucumber, ginger, and turmeric. So I did that for a week. And probably in 2 weeks' time, I was supposed to take another result. Lo and behold, I went to test. I was negative.
Okay, the smoothies bit, is that
Yes.
also some advice that you got from someone?
Yes. The company has a dietitian.
All right.
So fast forward, he called me. He was like, "Oh, Charlie, forget. You will cross some." He just gave me the smoothie, the remedies, and that was all.
Okay. Did you have to suffer stigmatization?
No. The company was so good. The guys out there were so good, and my family members, amazing. My fiancée did so much, though she didn't pass by, but she was amazing. Those who were close within my circle will call you, how you faring, and all that. My boss will always do that, and the dietitian will always do that. So I felt loved. I bounced back to work some months ago, and everybody was welcoming. Everyone was welcoming.
All right. The other story, I'm sure you've heard of the stories of people who have COVID-19 and they're having to live with complications thereafter. Are you experiencing any such thing?
No. I'm super good. I'm super good.
Have you had to go to the hospital to do any lab tests, maybe a brain CT as Shirley had to do? As
No,
in check
I
on
haven't done
the
that.
body, check, have
I-
any scans of your body organs?
No, sir, I haven't done that.
Okay. Dr. Techi, we heard Shirley talk about the fact that she had to do a brain CT. And it's probably because she wanted to be sure that everything was fine with her. Would you advise Nana Kwesi and other people, other COVID-19 survivors, to do some of these tests? I know you've mentioned that some time ago.
Okay. Israel, Nana Kwesi, good morning. How are you?
Good morning. I'm doing well, sir.
Good. Israel, we don't do CT scans routinely for everybody who has COVID. So, I mean, if you come in and we need to do CT scan, it's because your clinical picture suggests that we need more information. And the COVID test may not be the only test results that we need. From what Nana Kwesi is saying, I didn't hear him say any symptoms. Nana Kwesi, what were the symptoms again?
I wasn't having any.
Okay.
Didn't have any.
So, okay. So, Israel, if you are asymptomatic for COVID and you just picked the test, we said you are positive, nobody in the world will do a CT image of any part of your body.
All right.
Okay. But if you are symptomatic, you have headaches, you have chest pain, then your saturation is low, as in oxygen saturation. We may want to CT your chest and see how bad your lungs are or how sick they are. If you're having persistent headaches, we want to CT your head because there are other causes of headache. And we don't want to think that every cause of headache is COVID. Before COVID, people were getting headaches. And those type of cause of headaches will still be there. They're not going to disappear because COVID has come. So it's a holistic care given to the patient. So your symptoms will determine the other test that needs to be done. So for Nana Kwesi, he's asymptomatic. So I'm not surprised he didn't need to do any of those tests. But ideally, if he had even come into UGMC, would have done some basic labs to have baseline, would have done at least full blood count, would have checked his kidney function, would have done his liver function test, and check other markers for inflammation, okay, as baseline, so that when there's something changes, we can always relate or compare to. But he didn't come to us. Nobody followed him up, which is a bit shocking, because I think once they pick you up as being
Dr. C, I find that quite shocking that all he had was a text message and he was told to self-isolate and nobody followed up. Could there be many more like him who nobody followed up?
I think it's the way, Nanakwesi, you were tested through your company, right?
Yes, sir.
Good. So Israel, there are a lot of banks that I work with during this COVID period. They were not being managed by the national team officially. I was managing them, as in me, Dr. Godfrey Techi. I was managing them together with a few others. But because I was in UGMC, we make sure we add their data to UGMC's data. So I'm sure there are others out there who manage people like that that probably were not added to the national data. So it's possible, just guessing, it's possible there could be others like that. But normally when you go through the company testing, most companies want to keep their own information. They don't want to make it public because of fear of stigma. So they want to manage people not even knowing that anybody in the company has tested positive, because they think it may have a bad image to the company. And reputation is right. Reputation. When the company loses its reputation, it's the costs to recover that reputation. It's something else.
Yeah.
So I'm sure that's why a lot of people were doing those things. So I would not be surprised if there are more people like him who were not followed up. But what I would say is this, as way of informing the public: if you test positive, everybody in Ghana lives in a community, and then all the country, especially in Accra, have been zoned for Ghana Health Service. So if you test positive, and it's your company that did your test for you, you yourself take it upon yourself to even call the numbers that were advertised for Ghana Health Service. But if you don't do that, how will the Ghana Health Service in your area know that Nana Kwesi you've tested positive? They have no knowledge of that. Okay? They have no knowledge of that. And I'm telling you, the people I manage for the banks, they all live in communities. Israel, they were not followed up by Ghana Health Service because Ghana Health Service, they don't know. So I followed them up. And I'm talking about over 100. I follow them up every day or every other day, depending on the complaints. So they recovered. But these will have been captured. And they are part of our database or national database.
All right.
But for those who are not managed by people like me or other doctors, then maybe we've lost that data.
That's unfortunate. Now, I have some questions coming through already. I have Georgette Amwako and says, this is to Dr. Techi. Have there been any repeated cases of COVID-19 in Ghana? Asking, I guess, people who have had COVID already and have tested positive again.
Georgette, thanks for your question. I am not aware. That doesn't mean it could be possible that somebody has had that, but I'm not aware. It's not been brought to my attention. What I know is that some people can test positive for a long time. Okay, I think it has been explained on this show before. Some people can test positive for a long time before they eventually even turn negative. But as to somebody who has had positive, recovered, they're reinfected, it's not been brought to my attention. Though I've read some articles in South Korea and the rest, but in Ghana, it hasn't been brought to my attention, Israel.
All right, so the other question from Georgette is, will one be immune to COVID-19 after recovery? And if yes, how long?
How long, we don't know. As Shirley was saying, some people produce antibodies. They mount a good response and produce antibodies. Some don't. and even those who are able to produce antibodies, we don't know how long the antibodies will stay in your system. This is a relatively new disease, and we are learning a lot. We don't know. So all I'll say is that, yes, you can mount a good response against the virus. You may have detectable antibodies in your bloodstream, but there's no clear evidence that that will protect you against your next infection if you get exposed. So prevention is the key.
All right. Then we have Chrissy in Cancer, who's also sending a message, says, how long did it take for them to recover in terms of days after testing positive? And so I'll put that.
Or me?
Yeah, I'll give that question to Shirley. Shirley, if you can tell us how long it took for you to recover in terms of days after testing positive.
Okay, so I think I did a test a week after commencement of medication, and that result was still positive. And I had another one in 2 weeks, which came back negative. So I would say 2 weeks.
All right. How about you, Nana Kwesi?
Yeah, same as what the lady said. It's just 2 weeks.
All right.
So I think during the second week, that was when I did my second testing and I was negative.
All right. Now, we've been joined by Dr. Kaba Akoreya. He's with the Ghana Health Service, and he knows quite a bit about the cases we have in the country. So I'd like to bring him in at this point. Dr. Kaba, if you could turn on your video and unmute, then we can bring you into the conversation. Otherwise, I'd like to introduce one other person who has joined us. And not sure what your name is, but I'd like you to introduce yourself, and then Galaxy S9.
Israel. This is David Annan.
Okay, yes. So you're also a survivor, I understand. So you tell us what your story is.
Oh, okay. Well,
By the way, David Annan, let me introduce, or you introduce yourself, and you tell us your story.
Okay. David Annan is presently a commissioner at the Development Planning Commission. And I tested positive. That should be about 3 months ago. I just had a high temperature in the night. And then I went to a hospital. They tested malaria and everything, but nothing. The following day, I saw my doctor, who asked me to go do some tests to see whether there are any inflammations in the blood. Then he saw that the ferritin content was very high. So immediately he said, oh, why don't we test for COVID? And then I did that one, and it was positive. But apart from the temperature, I didn't have any problem, nothing. Everything was right. I didn't have any, no coughing, no pain, no nothing. So just for the 2 days. And thereafter, I was fine. I was put on, from the beginning, some azithromycin, and then went through the 3 days of that. Then after that, because of the high ferritin, they said there could be some clotting. So they did some few injections of some medication that would help stop any clotting. And then that went on for 1 week. And I think, but I didn't have any problems of, I have pain here, I'm not feeling this, I'm feeling, no, nothing at all. Everything was fine with me. So let me say that within about a week, I was fine. But I still stayed in the hospital because I've had a history of having very repeated cold. And so because of that, sometimes I had a problem with, how do you call it? Short of breath. So my doctor advised that, look, it's better I get kept in the hospital for observation. And I think in about 1 week, I was fine. But I still stayed on observation for some time. And thereafter, I got discharged. And I have been very fine to today.
Have you had any complications thereafter, or anything that suggests to you that something is all right with your system after recovery?
After recovery, everything has been fine, very, very fine. What one problem, I had somebody sharing a ward with me in the hospital, and the person, had some few complications because I was fine. So I was more like the one who was trying to keep the person active anytime the doctors and the nurses were not around. And so it made me not have enough sleep for 2 days. And that hired up my pressure from about 120/80, went as high as about 200/110. So immediately they realized that, look, this is somebody who doesn't have a problem, but this thing has gone up. So they gave me some medication to let me sleep enough for some time, and it came down. But they realized that, look, you are just here for observation, not because you really have any complications. So that was the time when I was discharged and I went home. And the pressure, I have, it's more like now a little above what has been very normal. But now I think everything has stabilized in the last 2 months. I think it's normalized now.
All right. I'll bring in Dr. Techi at this point. Dr. Techi, would you have any advice for Mr. Annan?
I don't know if I heard him right. Did he say he's hypertensive?
I didn't.
I'm sorry. Good morning.
Oh, good morning, Doc. And how are you too?
I'm fine by the grace of God.
Okay. No, I wasn't earlier diagnosed as being hypertensive, but now it's like because it went up that level, my doctor tells me that I should now bear in mind that I have very mild hypertension.
You said you got to 200?
I got to 200/110. But in a day when I've forgotten the medication they gave me, that made me sleep for some time. And so then it came down to about 160 thereabout. And then by the second day, it was around the 150, 160. So they realized that, look, this is a person who didn't have any pressure problem. And therefore, they thought that the environment was rather becoming a challenge for me because I was sharing a ward with someone. So at that point, they said, look, it's better for me to go home. So I went home.
So what has been your BP like since you left and went home?
Oh, I checked every morning. This morning, I do it 2 times a day. Last night, it was 117/77. This morning, it was 126/79.
Please, are you taking any BP drugs?
I have been on amlodipine, but they started me on 5 milligrams. But I think about a week ago, anytime I took it, my doctor told me, look, you never had it. So if you get to a point and you are taking it, you get any abnormal signs, let's know. So I told him that anytime I take the measurement of the pressure before I take it. Okay. And since it came below 120, anytime I took the 5 milligrams, it makes me a little dizzy a bit after about some 45 minutes. So I told him, then he said, no, it means that your pressure is stabilizing, but we cannot take you off immediately. And so he said, you can have half of that 5 milligrams. That's a line on it. So he said you could divide it along that line and take the 5 and see. So I have been on the 5 for the past 4 days, and I think it's remained around between 115 to 115/77, like I said, up to about when it comes up in the morning. I also realized that in the mornings it's a little higher. So in the mornings, that's what this morning I said. I saw 126/79. But apart from that, oftentimes in the evenings, it's
no, it's okay.
Go
on. Okay.
Yeah.
Okay. Well, the advice I have is this: for those who have chronic medical conditions, i.e., hypertension, diabetes, sickle cell, kidney disease, and the likes, cancer, and the like, we know from data that if you get COVID, you tend to have severe form of the disease. So the advice here is that if you have any chronic medical condition, make sure it's well under control, so that in the unlikely event you get exposed to COVID, because you're already at a almost or a near normal state of your disease, and your body should behave like somebody without those chronic medical conditions. Because you were not a known hypertensive or somebody who is a known hypertensive, and your BP went as high as 200 and something, I think you are hypertensive and you probably did not know. Because for you to get to 200, stress alone cannot take you to 200 unless there's something else ongoing, which you didn't know. So, okay. Mr. Anna, what I would say is, I'm not trying to steal you from your regular doctor or anything, but I would say if you have time, pass by the University of Ghana Medical Center, let's do a thorough workup on you, and we can tell you whether you are hypertensive or not, and we'll manage you and make sure you are in a very stable state of whatever illness it is that you have. Going forward, continue to adhere to all the safety protocols, and in addition, get good rest, drink a lot of water, exercise as much as your body can tolerate. That's all I would say. Thank you.
All right, but maybe before I go off, Israel, Dr. Tichi, thank you very much. I was a patient there. I was actually admitted in the University of Ghana Medical Center. But so I have a memory of the good work you guys are doing over there. And keep on.
Thank you. But I would like to see you back. I want to see you back. Thank you. Not for COVID. Okay. Let's talk about the BP. Thank you.
Okay. All right. Okay. I'm happy.
Yeah, Ms. Anna, and I was asking, have you had to deal with stigma when you had COVID?
I really, people didn't even get to know that I had a problem, because most of the work I was doing was virtual, and I also and I wasn't going out much. And apart from the people, my close family, and maybe a couple of friends who got to know, I really haven't experienced any stigmatization coming out. In fact, from the beginning, I was rather scared of people because I didn't know where I contracted it, and nobody close to me, not even anybody in my family, was exposed to it. I would say exposed to it or showed any sign of infection. You know, so I didn't face any stigmatization. I haven't felt it.
All right. What are you doing differently now to keep yourself safe that you were not doing before?
I thought I was strong all the time. I never used to exercise, but like Dr. Techi said, I have now taken up the exercise, and in fact, I started every other day. I do a walk of minimum about 3 kilometers. You know, I never used to do much of that one. I have been one of those ones who have been very much concerned about maybe a treadmill at home, but I realize sometimes if you just do the treadmill at home with nobody around you, you just do a little and you stop for some time, and it demands a lot of discipline to be able to do that. So I rather do a walk outside. I live in a quiet environment, so I do that outside walk. I do that one. And then secondly, so try not to get myself overly exposed.
All right, so you mean your face mask?
Yes, I keep the face mask on as frequently as possible. I get it off. Like now I'm speaking with you, I'm sitting in the car. That's when I'm alone. So, but apart from that, if I'm within an environment where there's no one around, I keep it off. But the moment people come around me, I put it on.
Okay. Which is smart. It's a smart thing to do. I'd want to ask Nana Kwesi the same question. Are you doing anything differently?
Yes, I take in a lot of water. I take a lot of ginger tea early in the morning, and I do a little bit of exercise. Yes, that's really necessary. And I rest a lot, especially on the weekends where I don't go anywhere. I rest a lot.
Okay. How about you, Shirley?
I think it was when I returned initially to work. I was a little psychologically affected. So anytime a patient came in, you would want to suspect that um, you could be infected again. But I think I'm okay now. I'm not doing anything differently. I'm just the same person, except that I'm more observing of the social distancing, um, even with the clients. Yeah.
All right. Now, the next question I have for all of you, the survivors, is how you feel when you see that people are not observing the protocols as have been advised. You know, people are not wearing their face masks, and we're getting reports that people are just have thrown caution to the wind. How you feel about it and what you have to tell them. But I would also want to, so I have this message coming from Dr. Emadai. Dr. Emadai used to be at UGMC. She's part of the COVID team. She's an biologist. She says, I agree with Dr. Techi. Stress alone will not take one's BP to 200 and above. And I believe he's a newly diagnosed hypertensive. So that's for you, Mr. Anand. It's coming from Dr. Emadai. So you really need to check into UGM and get to see Dr. Techi as his advice. So Nana, Shirley, the question I want to, how do you feel when you look around and it turns out that people are not really observing the protocols and they have their face mask off all the time?
I think from the beginning of COVID in Ghana, we've had two types of people. Those who believed in the existence of COVID and those who still do not believe in the existence of COVID. Some changed their mind when they got to see people who are close to them get infected. But there are others who still think that COVID is not in Ghana. There are people who still think that COVID is not in Ghana. So for me, we need more education, even though when I see them, what comes into my mind is the person who is standing to you is likely to be positive because you can't see a COVID positive patient unless the person is showing symptoms. So more education needs to go down. COVID, unless I'm showing symptoms, you cannot tell whether I am positive or not. Be it in the bank, in your house, anywhere you go, the person next to you can be positive, a COVID positive patient. So we should all take note and observe the protocols, masks on and social distancing.
All right, Mr. Anand. What goes through your mind when you see people who are not observing the protocols?
I have not, refused to be spreading it and telling people that look, COVID is real, and those whom I get very close to, the few people, I tell them, please use your mask because it's real. At my level, I do tell people, those I meet who are not, trying to observe the protocols, I tell them quietly, look, I have recovered and it's real and it's not a good experience. So please, don't take it for granted. I keep saying that one to those whom I come very closely in touch with. Because sometimes when you just advise, they take it for granted. And especially it's become very bad of late when they hear that the figures are coming down.
Yes.
People have thrown caution to the wind. I am a very active political figure. I have been refusing to talk about that one, but let me say that you meet people out there, and in the beginning they seem to be conscious, and they wear it, but in the frenzy of the moment, they throw caution to the wind, or you get people still having to draw it to their chin. And I tell them that look, that's not the way to do it. In fact, coming to people drawing to the chin, it is now time for people to know that if you speak with someone and some of the COVID, is a protein chain, I don't want to call it whatever, the agent falls on the mask and you hold it and pull it down, you have infected your hand. And anytime it gets closer to any of those entry points, you get infected. Those are some of the things I tell people. It is better for one to remove it and hold the ends rather than touching the middle all the time. That's by my understanding. That if you touch it and you are holding the frontage all the time and holding it, you whatever might have collected on the surface of the mask, you put it on your fingers and it can reach your body through any of the entry points. So I tell them all the time that look, this thing is real. You might not be when you get infected, you may not get very sick like it happened to me, but you don't know whom you would also infect. And that person might have some underlying condition already, and you worsen it up, and probably now maybe.
All right, great. I'd like Shirley to come in here. Whatever Mr. Annan has said is actually true. It's gospel. So I want you to essentially reiterate it.
With regards to donning of the face masks.
And dropping it to the chin.
Okay. So I would have wished I prepared and had a face mask close to me. So when you don on the face mask, it should always cover up to the nose, whether you are using the homemade one or the medical one. It should always cover up to the nose and then tied behind, or it should go behind the ears. You shouldn't hang it on one ear. You find people, I mean, it's just to one ear and the mask is dangling, or like he says, some people bring it down whenever they want to talk. But that is why you are supposed to have the face mask on. But we are rather doing the opposite. We wear the mask when we are quiet, and we remove it when we want to talk. But when you are talking, then the organism is escaping, and whoever is close, it means that you are transmitting. So rather, we should have the face mask on whenever we are in a communication with someone else, not to remove it or bring it to the bridge of the nose. And as he rightly said, when you want to remove it, is you use both hands and you remove it from this side and the other side at the same time, and then you drop it into the dustbin. When you remove it and you turn it facing the side that is facing your mouth, assuming you coughed or you talked whilst it is on, or you even breathe, because some of them comes in whilst through breathing, and you held the part that was close to your skin, you've gotten yourself infected. In actual fact, that is how come we end up spreading it around, because then you go touching handles, greeting people, shaking people without the proper sanitation of the hand. That is either with the alcohol rub, the hand sanitizer, or water and soap, proper hand washing. If that has not been done, we end up spreading the infection. So every time, as we said, you maintain social distance and you have your mask on, or two sides, either tied at the back of your head, or if it is the one that goes around your ear, you do properly so. And then if you have to remove it, is you send the two hands, remove here, remove there, and then you can drop it. It's not that you drop it halfway or you bring it down anytime you have to talk. No, have it on anytime you want to talk. And every time you remove it, you have to do the proper hand washing. Thank you.
All right, before you go off, it was a good point you made. But the question I have is, if you're taking off your masks, the reusable ones, and you take it off, you are indicating you take it off and trash it, but we don't trash the reusable ones. So how do you handle, how do you manage those ones?
The reusable ones, you can just put it in, what do you call it, your bucket, add a little bit of disinfectants to it. You wash it and you keep it in the sun. You dry it in the sun.
Okay,
and then
so
whilst you're...
This is not the time when you're, I mean, this is when you're disposing it off. I'm talking about when you're maybe taking it off briefly, maybe to eat or have a drink.
So if you are removing it briefly to eat, like I said, is the two hands, you go like that, you remove it, and then you can drop it. So the part that was facing you shouldn't be on the table, because then when you pick it, wherever you left it, whoever sits there is going to get infected. Please, are you with me?
Yes.
So if you are eating, then you have to remove it. And perhaps if you can put it on your laps or something, but not to, like, some people just drop it. They just remove one side and hang it. And then whilst they are trying to put it back, they end up holding the part that was touching the mouth or the nose and get the hand infected. So if you can just remove it like that, and then it's the part that was facing your face now face up on you, like you put it on your laps, and then when you are done, you can quickly send it back.
All right. Dr. Techi, I'm sure you'd like to add something to it about etiquette when it comes to the face mask, the use of the face mask.
Okay, because a lot of good points have been shared already. The only addition I'll make is anytime you touch any part of the mask, you wash your hands. So you wash your hands with soap and water. Assuming you want to adjust or do whatever you want to do with the mask, whether to eat, to do whatever. Once you touch the mask and you are done, you must wash your hand with soap and water before you continue whatever you are doing. Then just to expand a little on the point of people removing their masks to talk. Israel, I don't know where it came from. I'm still shocked why they do that. Because the rationale for the masks from WHO from the beginning was that you put on the mask so that if you don't even know you have the infection, you don't easily spread it to people doing activities like singing, talking, or sneezing, or coughing, or whatever. But I find people granting interview, and that is the time to remove the masks. And the worst offenders of this are the politicians. When they go about talking, granting interviews, they remove their masks and talk. And I'm surprised the media actually allows them to do that. Because then the mic you are giving them, if they have COVID, they will infect your mic. So I'm pleading, let's insist that people wear their masks, especially to talk. After when they talk, we can hear what they are saying. I've given interview to your TV stations, at the multimedia with my mask on, and they heard me clear. So if we can use your media to tell people, and also journalists, that they should insist people put on their masks and talk. That's all I'll add to that. Thank you.
Yeah, but Dr. Techi, you know, when you're actually speaking and you have your mask on, you can express yourself freely. So that's why we like to, you know, take off the mask. And
Israel is not true. Israel is not true. I can send you my video I did with Adom TV. They interviewed me. I was wearing masks. My voice was clear, crystal. They heard everything I said. It's not true. Israel is not true. You see, there are certain small things we do that aid the spread of the virus. But because people are not talking about it, we think, oh, it's normal. And I'm saying that currently now in Ghana, most of the interviews being granted are politicians. And what I see on TV is what I'm saying. They remove the masks and talk. And it's becoming, you see, once the politicians, they are supposed to be like, in quotes, role models for us. Yeah. So if a politician does something or a musician does something, they call them celebrities. Everybody tends to think it's okay. And that is where I have a problem with. Let's do the right things and let the right things be copied as okay and not the wrong things, Israel. Thank you.
All right, we have Dr. Emma Adai, who's also joining the conversation. Dr. Adai, if you could, let's see your video, and then you get to add to all that has been said.
Hello, Israel.
Yes, so I'm sure you've heard the bits of advice that's come from Shirley and from Dr. Techi. And the survivor as well, Mr. Anand. So What more do you have to add to it?
Okay, thank you. I think essentially the key thing about all this is about the principles. And some of those principles are what Dr. Atichi was trying to point out, and Shelley as well. The principle of wearing the mask is to prevent the aerosols from being transmitted. So in the first place, you should probably, as Shelley said, you should cover the nose and the mouth. And then in trying to handle the mask at any point in time, you have to remember that the part that does not face you, or the part that does not come into contact with your face, is the part that faces the environment and can pick the aerosols from any site. Therefore, as much as possible, you should not touch that part of the mask. So rightly said, to remove the mask, you should go from behind your ear, because that's the part that is least exposed. So you should go from behind your ear to remove the mask. Now, as you asked earlier, you said in between use, what should you do? When you take the mask off in between use, and one mistake some people make is to put it in their bags, and then later pick it up from your bag again. But your bag has all kinds of things. It has your phone, it may have your keys and other things. So the proper thing to do, if you could, is to have tissue or a paper or even a container that when you remove the mask, you can place it onto or into where the outermost part lying on or in that surface. So to repeat, you should have tissue. For example, you're about to eat. Take it off. You can put tissue on the side of the table, not where you're eating, the side of the table, and then place the mask, the outer parts downward with the part that faces you, pointing upward, as Shelley said. Or you can have a small container that you put the mask in when you're not using, in that same position. But do not put the mask directly into your bag. That is one thing, or onto your phone. And then again, as Dr. Atichi said, every time you touch the mask, you should wash your hands. If you can't wash your hands, you should use the hand sanitizer. If you don't have access to water, the better thing is to wash your hands with soap and water. If you can't, use a sanitizer. And then when you need to wear the mask again, you hold the straps. You always hold the mask from the straps. Atichi is another important point about people bringing on the mask and talking. I agree absolutely with him. The mask should be on when you're talking. They're thinking that when the mask is on, you sound muffled or something. It's a fact, actually. Lots of people have that. They think it's so, they conclude that that's the way it is. But if you're wearing the mask, it's just about projecting your voice through the mask. It's not something that is too tight on your face. So if you project your voice, you'll still be heard audibly, and it will serve the purpose. Now, one thing that I think has not been mentioned is a lot of people wear the mask, and then because in the beginning they do not wear it well to fit their face. The surgical mask, or the commonly blue and white, others green and white mask that we see, the ones that are single use, it has a moldable bridge for the top of the nose. Once you wear it, you can press on it and mold it to fit the bridge of your nose. I think you see the mask I'm talking about. A lot of people wear it, do not mold it to get that fit. So when they start talking, it begins to slip. Then they now have to touch the mask and shift it in several angles. Once you put on the mask, one of the techniques is to ensure that you have a good fit the first time you put on the mask. If you fit it well, once you remove it, it would have taken on the shape around your nose and your mouth. You understand? Even with the N95, you're supposed to mold it to fit your face. So don't just slip the strings behind your ear and start talking. Then when it slips, you try to adjust it. From the beginning, when you wear the mask, fit it well on your face, such that if you were to remove it, it would take the shape around your nose and your mouth. And that is very key. And once you do that, it minimizes the tendency to try and touch the front of the mask, which a lot of people do sometimes unconsciously. But if you happen to touch it by mistake, it's the same principle. You have to wash your hands with soap and water or with a hand sanitizer. Israel.
All right, so I have the N95 here, and this is the mold that Dr. Mada is talking about, right here. So it's this mold that typically,
yeah, exactly.
when you get the mask, it's straight like this. The mold is like this.
Yeah.
But then when you put it on your nose, then you have to, in fact, I'm going to use the surgical mask. So here's a surgical mask. So it goes on the face, over the nose, and then you strap it here, and then there, and then the mold is here, right?
Exactly.
So you press it down, and then it takes the shape of your nose. That's what you're saying.
Exactly. So with that position, once you take it off, you just take off the mask right now.
Okay.
Once you take it off, slowly, good. Yeah. You realize that that shape that's maintained for the bridge of your nose.
Yes.
Exactly. So this is the way the mask should look once you take it off. If you do not mold it like this, it keeps slipping. Sometimes you are talking, it will be coming down, then there's the tendency to try and adjust it, push it in all kinds of ways. And also, if a mask is lying down this way, even if it looks clean, immediately you know it has been used.
Okay. Okay. So
immediately.
Once it's been molded, once the mold has been tampered with, then you should know that it's been used.
Exactly. So it's another way of identifying a mask that has been used, so that you don't end up picking a mask because it looks clean, it's lying somewhere clean, and so you think, oh, there's a new mask. You see the mold, and immediately you know this has been used by someone. You understand? So it's also a feature.
Okay. Thank you very much. That's really good advice as far as the use of mask is concerned. Dr. Techi, these are some really good lessons. And I believe Mr. Annan, and as for Shirley, she already knows it. She's a clinician, and so she's very much aware of how to use this one. And but you, Nana Kwesi, I hope you've learned some new things. You'd have to unmute, Nana Kwesi.
Yes, I'm really learning a new thing from the doctors. It's very nice and very educative.
Yeah. All right. Shirley has something. Shirley, you have your hand up.
Yes. My concern has to do with the reusable ones. Because of the cost, you can't ask most of our folks to go for the simple face mask because it's pretty expensive, meaning that they have to reuse it over and over again. So most of them have the cloth one. The caution I want to put across is that I think most people, when they are ready to go out, they take it and put it on. When they return back from town, they come to put it down. And the next morning, it is on again. We have to ensure, and again, the education has to go down that it has to be washed. It has to be washed. When you remove it off, like Dr. Techi said, you wash your hands every time you touch it. But once the day is over, please wash it with a little bit of just soap and dry it in the sun, and then you can reuse it. Because if you use it and you come and put it down and the next day you take it and there are, anything in it, it means that now you are going on to spread it instead of preventing it from happening. Yeah, so that's what I wanted to put across.
All right, thank you very much, Shirley. Now, for the rest of you, if you have any questions at all, you can always raise your hand and I'll bring you in. But we have this contribution coming in, and it's from Onya Kofi Samwamens. It says, post-COVID-19 syndrome is real. The cough, joint pains, the malaise still persist after discharge. Some of us got our positive test 3 weeks after the sample was taken. So I wasn't in isolation, but the symptoms are still there. All but one of my team members had it, and each one of us has symptoms post recovery, discharge. So this is someone else's story. And I also have this comment coming in from Chrissy. But before that, I have 2 hands up, and I'd like to go to that before. All right, so Dr. Kaba finally is able to join us. Hello, Dr. Kaba. So let me bring you in at this point. Yes.
All right. Thank you so very much, Israel, and all the participants and the people listening. I want to pick this from the perspective of some of the studies we've done, evidence-based. One, the use of the face masks, we've actually seen a decline, a drastic decline in its use.
Dr. Kaba, is it possible to turn on your video?
I'm actually driving, so
all right.
I just thought, let me see how best to.
No, if you're driving.
Yeah. So, yeah, no, I've parked to talk, so
okay.
no problem. So, as I was saying, some evidence-based things that we've come across is that we've realized that the use of the face masks has drastically dropped. And worst of it is in the night. People in the night, they think COVID is only during the day. And then in the night, it goes to sleep as well. But that ain't true. So if you walk on the streets of Accra, you see that in the night when people are sitting in small gatherings or big, they virtually don't have their face masks on. But the face mask is supposed to be used all the time once you are with people. So it's one of the things that I think we should be hammering on. The second thing I want to say is that I heard someone ask a question about reinfection in Ghana. To the best of my knowledge, we only had one case that we are writing something on in Rich Hospital. I was actually in Rich Hospital. I just left there some few minutes ago. And we are able to talk about reinfection because this gentleman had the COVID, tested positive, and then had a 2 test negative and was discharged. 2-3 months down the line, he came back and tested positive again. Now, with our recent discharge criteria, it's very difficult to talk about reinfection because then they don't get the 2 serial tests before they go home. But this is the only person that I do know that it actually did happen, and very soon we'll be publishing something on it. Mr. Israel, one other important thing I want to bring to our notice is people substitute the mask with the shield. That is absolutely not recommended. You have the mask on, then you can still put on your face shield, but you don't take off the mask and then replace it with the shield. Then it creates a lot of problems because you don't actually have the protection as you should have. And once you're wearing the mask too, it doesn't substitute the social distancing. You have your mask on, but you still have to observe the social distance. I always tell people when I get into their midst and they are without a mask, I say, hey, Chief, you are cheating me. Because I'm using the mask, I'm protecting you, but you are not using, so you are not protecting me. Then we smile and then they'll put on their masks. So I think we all have to find a way of contributing to people actually adhering to the use of the mask, especially in the night, and especially not substituting with the shield, but using the two, complementing. One complements the next. And I think that what Dr. Techi and the rest of the team said is on spot. And if we are able to adhere to all that, I think we'll make a good headway.
Okay. Now that we have you on, Dr. Kaba, the conversation we've been having, the issue that's come up is, do we have COVID-19 cases or people who have had COVID-19 and recovered, having to make frequent visits to the hospital for other health complications here in Ghana?
From some of the literature we are reviewing in Ghana, I'm not talking about any other person's literature. I'm talking about what we are seeing. Yes, we've had some couple of patients who have come with lung fibrosis. I mean, complications with the lungs. I don't want to use a lot of words here. That they have some kind of post-COVID respiratory issues. And some too, we even tried to publish one in the college journal. Some too, they become diabetic. They weren't diabetic before, like, no, I mean, they visit because of the uncontrolled sugar level. Some too, the hypertension. I heard a gentleman talk about it. Yes, some too remain, they become hypertensive. So we've had a couple of cases with that. And the good news at the time was that when we had people in GA East or UGMC or PCC, most of them we did baseline assessment, at least on laboratory tests, and then chest X-rays. Some even benefited from CT scan. So we were able to know where they were before the COVID or during the COVID. Then when they come back and they have this and we repeat the test, we do know that yes, this is post-COVID sequence. So yes, we do have people visiting. Yeah.
All right. There's this contribution or question that is coming, and I'd like to put it to you before we lose you or you get on with your ride. Chris in Kansas says, I was supposed to be in Ghana in April, but due to the closure of the border, I couldn't come home. In April, I lost my appetite and I was feeling feverish. Even though I didn't test for COVID, I did self-medication and I felt better after some few days. Last month, I felt the same loss of appetite and body pains. I'm confused about it. Do you have any advice for Chris in Cancer, Dr. Kaba?
Yeah, absolutely, I do. If Chris is listening, the first thing is that you need to visit your doctor. I don't know which country you find yourself in, but self-medication is not the way to go. I do remember, even I'll give you a typical example here in Ghana. A gentleman had COVID, and then he saw the friend. 2 days later, the friend also came out with some symptoms. Then the friend decided to go to the pharmacy. He took the prescription of his friend. And so when my friend had the COVID, this is the drug they prescribed for him. So he took the same prescription, went to the pharmacy, and one of the drugs we were giving had sulfur content, and one is phosphate. I won't go too detail into it. But he bought the wrong drug. And when he took the drug, he started with allergic reaction. And then he called me and I said, no, what you are taking is wrong. He said, oh, that's what they prescribed for my friend. I said, no, you look at what was prescribed for your friend very well. So self-medication is something that I personally do not encourage people. And two, he might be thinking that because he lost appetite the first time and he was feverish, that was COVID. And now too, he's getting COVID again. That is not how it works. So because there are other diseases that also start with loss of appetite and then fever. So I would recommend that he kindly go to the hospital. And then among the things they will do would include the testing for COVID. So that would be my straightforward advice.
All right. Thank you very much, Dr. Kaba. I'll bring you in, Dr. Amadai, at this point. Dr. Adai, what is your take on, first of all, the repeat tests or the likelihood of COVID, and I've had recovered and had it again?
Okay, so I think like Dr. Kaba said, we have no way of confirming, if you like, that the first time around it was COVID. From the message that came through, it could have been COVID, but it could have also been something else. So again, there are a number of conditions that can present that way. So what I'll say is it is possible. I cannot rule it out, and I also cannot confirm it. So the best thing would be for the person to go to the hospital. Now, with investigations, some of the investigations, like the imaging, like the CT scans and things, they can give us a certain view. That can give us an idea of even if the person previously had COVID, based on some of the findings on the CT scan or some of the imaging. So the best thing would be to go to the hospital and be checked out. But he or she should relax and not panic or rush to get any medication. I wanted to comment on the self-medication thing. As Dr. Kaba said, apart from the fact that you may get the wrong medication, you may get the right medication that was prescribed for a colleague, but that drug may not be good for you as a person. For example, there's someone I knew who had COVID, but also has a condition we call G6PD defects. I won't go into that, but people with that condition are not supposed to take certain drugs. And if it's known, in fact, whenever you go to a hospital, if you have that condition, you're supposed to immediately let your doctors or let health people know so that they do not put you on any of those medications. And this person just went into a pharmacy and bought one of the medications that they've heard is being used to treat COVID. And it was almost lethal. Fortunately, the person took only one dose and intervention came immediately, but it could have become a suicide mission immediately. So what's our space? And then also with COVID, you know, I was mainly with the ICU or the intensive care, the very ill ones. And we realized that the treatment was never the same for everybody. As in the medications we gave were tailored to suit the patient, considering a whole lot of things, the age, the weight, the comorbidities, allergy, a whole lot of situations. So there's no hard and fast. It's not like malaria where we say, oh, maybe go and take Coartem or go and take this particular anti-malarial and we'll write it for about 10 people. You actually take a lot into consideration, especially if you are very ill, before we treat you. So the management for 2 patients may not be the same. So it's not advisable to self-medicate. It's always good to be seen first so that you be put on the right medication. Israel.
All right, thank you. I'd like to bring Dr. Stechi at this point. Dr. Stechi, I'm sure you have lots of advice to also add to what has been said by Dr. Kaba and Dr. Adai.
Yeah, the only thing I will say is for the gentleman who called, in addition to what has been said by my colleagues, we could also do the antibody test for him if he was like here. That would tell us.
Okay, that's Chrissy.
Yes, whether he was exposed.
Out of the country, yeah.
Yeah, whether he was exposed and was able to mount a good antibody response. Because as I said earlier, some people have been exposed, or some people actually tested positive for COVID, but they don't have any antibodies at all. So when you do the test, it doesn't show. But if he is part of those group that were able to mount a good response, then in addition to the CT and the rest, they could also do the antibody test to see whether we could get some relevant information from that. Besides that, I agree with all the things that my colleagues, Dr. Kaba has said and what Dr. Enima Adai has said. I agree with him.
Right, Dr. Adai, I want to know from you what the situation is as far as people coming in with complications. You probably may have had a lot more experience or encounters.
Okay, Israel, do you mean post-COVID?
Post-COVID, people who have recovered and yet have complications.
Yeah, so commonly what we are finding is that there are a number of people who have recovered and still have, as Dr. Kaba said, respiratory complications, still have cough, some have sore throats, sometimes some difficulty in breathing on and off, especially those who came through the intensive care unit and are gone home. There are also those who now have high sugars or high glucose levels that they didn't have before, and blood pressure that they didn't have before as well. We've also found that some people have post-COVID now developed symptoms that look like asthma that they didn't have before. But the good thing is that most, I'm sure in most places, once you are discharged, you are advised to come for reviews. They are given counseling on follow-ups in case of anything at all. So a lot of the patients, we still stay in touch with them. And then if they have any condition, they are still able to contact the facilities where they were handled or the doctors who took care of them. And they are managed, or they are a closer eye is kept on them. For some people too, they already had certain conditions, but they were not diagnosed. For example, there are some people who are already hypertensive or who are already diabetic, but never knew it, never had any symptoms, so they didn't know. And then maybe they were diagnosed with COVID. And as Dr. Kaba said, and Dr. Techi also have said, through COVID, we screen you not just for the COVID. We do a number of laboratory tests and investigations. So sometimes we pick up certain conditions that you may have had that you didn't know of previously. So post-COVID, we get to monitor those conditions closer. Now, with those scenarios, it's not that it is the COVID that has made you a hypertensive or the COVID that has made you a diabetic. But somehow through COVID, we also discovered something else that probably was going on in your system already. And with that, it's not necessarily negative because maybe had it not been known, it could have just been a matter of time before one would have had some complication anyway. And we've also had some severe cases of COVID who came and had complications like psychiatric complications that post-recovery have had a few more symptoms, not as severe as during the COVID. But at least now, because that was seen during the COVID, they are monitored post-COVID and are given specialist management. So generally, it's teamwork with both the medics and the clients. Israel.
Thank you. So one thing I want to get from you is you have been in close proximity with people who have had COVID. You've treated them. And I'd want this to go to all the doctors or clinicians. How have you kept yourself safe? Because you're having to wear, I'm sure all of you have had to don the full PPEs and taking them off. And this has happened several times. You've come so close to the people. How have you kept yourself safe? I'll start with you, Dr. Dai.
Yeah, Israel, how have we kept ourselves safe? Wow. I'll say it's a combination of factors. I think, first of all, I can't overemphasize that it's been the grace of God, to be honest with you. I always say we try to take the precautions, we try to follow the protocols as well as we can. But then there are some people who also take the precautions and follow the protocols as well as they know how, but still get infected, you know. So first of all, I'll say it's been God's grace. I mean, there's those of us who believe in God. It's been God's grace, lots of prayers and things. Beyond that, maybe because we know we are in the treatment centers, we are, I think, relatively stricter on our protocols than certain areas. As in most of the treatment facilities, and also especially in the intensive care units, we are extremely strict on the donning and doffing protocols. We don't allow any mistakes. It doesn't matter who you are, your rank, your level. You're supervised when you are donning and you're supervised when you are doffing, because we look at it like safety is as good as our weakest link. So no matter how well I protect myself, I believe that I can only be safe if I ensure that all my other colleagues are just as cautious. Otherwise, I can protect myself or try to as much as I can, and I still could get the infection. So the first thing has been teamwork, and then making sure that we all observe the protocols. And once we do it over and over again, it gets to a point, it becomes part of you, to the extent that even when you are not in the hospital and you're at home, you realize that some things become second nature, like the hand washing. You know, when you are learning the stuff for hand washing initially, it seems cumbersome, it seems like, oh, there's a lot of work. But you realize that as well over and over, it gets to a point where it becomes second nature, just like talking or saying hello. You realize that even when you are not paying attention, you wash your hands the right way, you are cautious with your mask. The same protocols we keep drumming in, but for you, it's become a habit or a pattern, you know, so it comes to you naturally. And another thing that we do is we try and practice what we preach. Again, I can't be telling everybody around me, wear your mask, wash your hands, if I'm not doing it myself. So at work, in church, at home, wherever I find myself, you know, people look up to me. So it's also something that pushes me personally to, even if I begin to feel easy about something, I remember that others would copy, just like Dr. Techi was saying. Some people become the examples, like the politicians, when they talk with their mask down, people look at them and think it's all right. So in the same way, we in the health fraternity, we know that if we do the wrong thing, people will look up to us and think it's fine. So that's also another check that I would say. Israel.
Dr. Techi, The same question goes to you. How have you
Israel Nima has said everything. There is nothing really else to even add. She has said everything. The first is by the grace and mercies of God. Then the protocols and the way we do our things together as a team. And that's, she said everything. I have nothing to say. She said everything.
She made the point that probably it's because you're being supervised. When you
that's what I'm saying. That what she said everything, because Israel, don't forget we are in the same facility. She's in ICU, I'm in the emergency and the COVID non-critical area, and we do the same things, basically in terms of the protocols. So the first is by the grace and mercies of God, because I'm a Christian, I believe in God. And the rest is just as she has said it. I don't want to be repetitive. She said everything, Israel.
All right. I want to come to Dr. Kaba again. And my concern is about people essentially refusing to wear or observe the protocols and wear their face masks. So for you, Dr. Kaba, and for all of you, I'd want us to send out a message to people like that. Or what is it that you think we can do to get people to observe the protocols again? Because people used to wear their face masks some time back. It turns out that in recent times, they're not doing that as often as they should. There has been the suggestion that we probably should be bringing in bring on board the traditional rulers. And I know that Ghana Health Service has done some or is doing some work in that regard. But what are some of the other ways we can get to bring everybody else on board? Okay, so Dr. Kaba is, Dr. Kaba. How do we get to bring everybody else on board so they can wear their masks and observe the protocols?
This is Israel, a broad-based approach, multidisciplinary approach, where you have to look at all the agencies. You have to bring on board everyone. You see, COVID is in a way that you can't leave anyone behind. And that anyone means the community. One is empowering the community to take the mantle and own it and understand the disease. And community empowerment here then means that we need to use all the community structures, including civil society, NGOs, CSOs. We need to use the government structures, not only them, as you rightly said. We started working with the traditional leaders, civil education. We need to bring everyone on board. School children, we need to educate them. We need everyone. Sometimes even you'll be surprised that when this COVID started and I get home, my children are the first people to come out and say, Daddy, you said we shouldn't come into the house with the clothes. Remove your clothes. Leave them here. Remove your shoes. And I was like, okay, good. They are now conscious of it. So I think we need to educate everyone, no matter how small the person is, and we need to use all the structures that exist within a society. That is, and then we keep repeating. I keep telling people that Israel, for you and I, the normal people, you need to repeat things so many times for us to understand. But for the genius, you can do it once. So we cannot get tired. We cannot get tired and say, we won't continue with the education. We need to keep educating until people own up to the disease. When there is that community ownership or community empowerment to own the disease, they will be telling themselves that, no, do it this way, do it this way, do it that way. That is the only way we can get many more people to come on board. Secondly, one of the things I did mention earlier had to do with the night behavior. If we are able to get everyone on board, then that behavior too will change a little bit. We all go to funerals, we all go to it, different occasions, and you find out that at the beginning everyone comes with a mask, but immediately they start drinking something, then the whole thing changes. And then gathering, they start to shout, and so we need to be conscious and keep hammering on these issues. In my view, that's the only way I think we can actually get people on board. Over.
Dr. Kaba, are you worried about a second wave, considering that people are not really observing the protocols?
Oh, yeah, Israel. Yeah, I'm worried about all the waves. First wave, all of them, because you see, we really still don't understand the behavior of this disease in Africa. We have been very fortunate. I made this statement somewhere that God has actually helped us a lot in this. We've been very fortunate. It started far away. We had a little window of opportunity to prepare ourselves in one way or the other. We do not have, we've done all the studies around. We do not have all the things that we need, like what the US and the UK and the rest they have. We don't. But yet the disease, one way or the other, has been a little benevolent. But do we know how it will come the next time? Absolutely no. And I still made those points. I said, look, if the health system is robust in Accra and Kumasi, it's not the same in the rest of the country. And we don't know when it hits the rest of the regions, how it will turn. So I'm really worried about all this. And I do believe that every medical person should be worried. Every Ghanaian should be worried. Every journalist should be, everyone within the society should be worried. And we should up the campaign and let people know that it's not over.
I'll come to you, Shirley. So on two things. First of all, what is it you think we can do to bring everybody else on board as far as observing the protocols, COVID-19 safety protocols are concerned? And as someone who works in as a medic, are you worried about a second wave?
So I'll take the second question first. I think that there can be a second wave. I also think that there has been a lot of Ghanaians who have been exposed, but because they didn't take the test, didn't know about it. As you can see from one of our participants, he didn't have any symptoms. So I think most Ghanaians have been exposed, but were not aware that they are positive. The second one is, they were positive, sorry. The second one is, what can we do? I think that there's been a lot of relaxation with regards to when it initially started. There were checks mounted everywhere to ensure people had their face masks on. And I think that if we could go back to that, not that much, but to ensure that everybody has the face mask on. And then if you don't have the face mask on, you are made to put one on before you go on. And then the other thing is that we can also increase the education on the social media platforms, get the involvement of the various both print and then radio and TV to enforce the education as you are doing today, for people to know that the disease has not left us. It's still with us. And if we don't observe the protocols, hand washing and donning of the face masks, we are likely to have a second wave.
All right, thank you. Dr. Techi. Oh no, before I come to you, Dr. Techi, Shirley, you didn't add the bit about, so I asked about the second wave, and I also asked what we could do to bring, I think you took care of everything. Thank you. So Dr. Techi.
Israel, what I want to say is, yes, we may not know the full extent of the long-term effects of COVID-19, okay? So for the young people out there, because the bio data or biostatistics favors the young people, most people think, oh, after all, what is it? If I get it, I'll recover. I'm a young person. I don't have hypertension, diabetes. But Israel, we don't know. All we know is what we can speak to based on available data now, right now. Okay, I've read that some people have been discharged or recovered from COVID-19. And down the line, they've had fatigue, cough, shortness of breath, as Dr. Nima Adai has said. Headaches, I've heard a lot of complaints about headaches. I've read about them too, joint pains and all that. And most people think COVID-19 affects just the lungs. From previous discussions on this platform, we've discussed that because they're receptors, COVID-19 can affect virtually every part of the body, okay? And we have evidence of people having issues with their hearts, which I shared on the last 2 episodes. People having issues with their CNS, the brain. And people having issues also with the lungs as well, the lung fibrosis and all that. So we are not out of the woods. So I don't want anybody thinking that because we've had a lot of recoveries, it means there's no problem. Me and you, Israel, or anybody out there in the health sector, we don't know for a fact how bad the long-term effects of COVID-19 will be for us, even for those who were asymptomatic. We don't know. Nobody knows. So that's the reason why we need to adhere to the safety protocols so we don't spread it, because we don't know. So I'll keep advising and using media platforms like this to reach out to everybody that we should continue adhering to the safety protocols. And that's what I'll say for now, Israel. Thank you.
All right, thank you. Dr. Enima, would you have any final comments?
Yeah, sure. Okay, so I think essentially most of the things have already been said. The only thing I'll add is that, like as Dr. Ichi said, for me, the main thing is we do not know what long-term effects COVID-19 has. So I know a lot of people have the notion, even if I get it, it's not likely to do anything to me, so why should I worry? There are more dangerous diseases, that things that can kill me faster than COVID. If a car knocked me down, I die instantly. COVID, I may survive. People do their own analysis of all sorts of things. But like we often say in the health sector, what you know and can do something about, there's no reason why you should allow yourself to be put down by that particular condition. There are certain conditions you do not know and you may not be able to do anything about, like certain things you are born with or certain things in your genes that, but for extreme interventions, you can't do anything about. You may not be able to do anything about those. But COVID, by God's grace, we have some information. We have some protocols that we know if we follow would reduce the risk of getting it. We know some of the things we can do to prevent getting it, to prevent getting it again, to prevent spreading it and all that. So there really is no reason why with all this knowledge, we should still sit down and fold our arms and be hit by it only to regret later. So my advice to everyone is, let's make use of the knowledge. It took a lot for some of these protocols to come about, or for people to realize some of the things we can do to prevent it and limit the spread. So let us make use of the knowledge for the sake of the next generation, so that the next generation don't come and blame us for negligence, certain things we didn't do that maybe led to a worse effect on them or anything like that. So as much as possible, when we are adhering to the protocols, it's not a selfish thing. Yes, I agree. If we were thinking of ourselves as individuals, there are a lot of people who can justify why they probably shouldn't bother. But as has been said by most of my colleagues, you should remember that it's not about you alone. You do not live as an island. There are other people that you could make the world worse for because of your negligence. And in the same way, even you who thinks you are very strong and can stand, you never know. We've also seen fit people who had no comorbidities, die out of COVID or even progress to have very severe disease. So let's just prevent it. Fortunately for us, the things we need to do are not too complicated. Wash your hands, wear the mask. We should look on the, in quotes, bright side. It could have been worse. It could have required more drastic measures to prevent. But these are things that we all can do. So we should encourage everybody to do it. And then the last thing I'll say is, I think to encourage people to adhere to the protocols, let us try and remove or disabuse people's minds from some of the myths. Some of the myths about COVID-19. Some people have certain myths, misconceptions. They've heard that, if I chew this tree or I eat this herb, I'm protected. I don't need to wear the mask. And so we disabuse people's minds of some of those misconceptions. They want to adhere to their protocols, not because they don't want to fight the disease, but maybe they are not adhering because they think they are fighting it in another way. You understand? So we need to point people in the right direction. All those misconceptions running around on social media that some people latch onto. So you ask them, why you know when the mask? Oh, I've done some inhalation with ginger and some herbs and some lemon, you know, so I'm protected. I can't spread it. I can't get it. I've chewed this tree. I've done this and that. So let's encourage people that even if you've done that, you still need to take this step, because that whatever I did may protect you, but you need to do this to protect others. And you need to come down to people's level of thinking or rationalization to get them to see the broader picture. Israel.
Thank you very much. So we come to the end of the show, today's show. We just have about a minute to go, but there have been some side conversations that have come through which I would want to share with you. So Shirley was indicating that my symptoms didn't go away the moment I was negative. I still had the headache, the cough, chest pain, fatigue for weeks. So the people, it's real that you may have it, you may recover, but you'd have to deal with some of the complications for a while. Thank you very much, Shirley, for sharing that with us. And thank you to all of you for joining the panel and for making the contributions, the insightful contributions, and sharing your knowledge with the rest of the world. So Dr. Techi, UGMC, thank you very much. Dr. Emadai, thank you. Shirley, thank you very much. Dr. Kaba, a courier of the Ghana Health Service, thank you too. And Nana Kwesi, who joined us earlier, a survivor who's had to leave. And then Mr. Anan, who also joined us earlier, but is no longer on the panel. So thank you all. You have a beautiful Sunday, and let's all stay safe so that we don't get COVID. Thank you.